Hi, I'm Dr. George Kosmides, and I've been asked a lot about different scenarios with blood sugar and why it's so important to focus on your health first and your blood sugar will follow. And I want to take you through this presentation today, and it can be pretty graphic. So if you're squeamish at all with medical pictures or with needles and such, you might want to skip those particular slides, and I'll let you know when they're going to come up. So if you want to look away or just listen to the audio, you can. But it's important that you know what the expectation is as you stay an entrenched type 2 diabetic, meaning your only course is medication and you really don't get aggressive and become self-aware and proactive in your care. And that goes for type 1s as well. So health first, and let's go through this presentation. So remember, the type 2 and type 1 diabetic, it affects your whole body. Eye damage, heart attacks, kidney damage, impotency, difficulty passing urine, digestive problems. I mean, the list is practically endless as research comes up with more and more systems that are affected. And if you think for a moment that, well, I control my blood sugar with my medication, that's the answer. Research is crystal clear that it's not. You need to become proactive. And unfortunately, I'm not really pleased with the type of information that's out there. I think a lot of it is inaccurate. So this slide is pretty indicative of the heart issues with diabetes. You're 2 to 3 times greater if you're a diabetic to have a heart-related issue, heart disease. 30% of the coronary stents will replacements of blood vessels in and around the heart. 30% of them are purely from diabetic patients. Almost 300,000 heart attacks per year, 2 to 4 times the morbidity rate for diabetics. So again, it's health, health, health. Don't focus on your numbers, focus on your health. I can't stress that enough. Let's look at the global dialysis market, because what happens is once you're on the medications, most diabetics that I've seen are on blood pressure medication or on some sort of a statin or a cholesterol drug. And all of these things have to be processed by all the organs, especially the kidneys, and they're very, very sensitive, so they get damaged. And then what happens is they can't filter the blood properly, and then patients then have to go to dialysis to get synthetically filtered. And this is kind of like factual data. Annual growth rate is over 5%, but look at the amount of financial money that's spent on dialysis, $15 billion per year. So again, it's a huge market. The U.S. by itself is almost a quarter of, or over a quarter of that, and it's rising at the rate of 5% a year U.S. and 7% annually. And I believe this study was 2011, so add on another 2% to that number. So again, I'm not stating there's a conspiracy. I'm here to just give you factual data. And do you really want to be one of these numbers? Okay, slides are going to start coming now showing the process that happens once you begin to go through the diabetic process with basically just relying on medications and not really being proactive. So dialysis is simply, you filter your blood, it comes out, goes through the filtering system, back again, and this is a pretty simple explanation. And then the machine is a pretty elaborate, and very nice people. Again, angels of mercy, the nurses there, no question. But the patient will be sitting there 3 to 4 hours per week, 3 to 4 times per week. So if you multiply that by time, let's say 3 hours times 3, that's 12 hours a week getting your blood filtered. And if you can't drive because of vision problems, now someone has to take you. So it can be pretty much a labor-intensive process. Again, this is not helping anything other than cleaning toxic elements out of your blood at a very, very low quality. Nothing works as well as the kidneys. They're marvels of engineering, but they're very sensitive to pressure and drugs, toxic elements. So here we're going to start with some pictures now, the processes that take place in the advanced stages. So this is the traditional hookup in the arm. And again, this is the filtering system. You'll be there 3 to 4 hours getting this done if you end up in these later stages. This gentleman here has a stent through his neck. Usually they'll have this because the arm veins become no longer tappable. They become so scarred because, again, you're getting this done 3 times a week. After several months, it just destroys those vessels, and they have to look elsewhere. This is a typical needle. The best way to describe the size of this needle is about the size of a knitting needle. That's pretty accurate. I think it's about a 12 or 16 gauge in a medical terminology, and it's a butterfly setup, and it goes. This one is right in the arm, in the cubital fossa, or the actual opening of the elbow there. Again, here come the pictures. Upper left-hand corner. This is an aneurysm, which is a bloodletting under the skin from a damaged blood vessel. The white scars are, again, tissues that have been damaged, and they form with calcium and other tissues trying to heal that, and there'll be hard masses underneath the skin. And we'll look to the right of that one, another aneurysm from, again, a tapping to go through dialysis. And you'll see these white areas, which are all scar tissue. And these develop to some extent in all dialysis patients in some level, to the point where they may even have to replace this with a synthetic vessel. Again, this is called a fistula, this is basically the arm folded up, where you can see the inside, and this is all scarring and damaged tissue from, again, recurrent tapping of that area. This is another extreme example. This is an Afro-American gentleman, so you can see the darkened areas where it has scarred in him. Again, they've tried several areas here. They've tried to tap into him. And again, another complication of the process of going through dialysis. Again, these are expected complications from the ADA, World Health Organization, the CDC. This is not something that I'm here to fabricate. And these are all the complications. Again, eye issues, retinopathy, MACD, or macular degeneration, where the eye literally dies from the inside, cataracts, glaucoma. All these are precursors to diabetes. Again, poor health needs to be emphasized here. Brain issues, transient ischemia attacks, which the brain basically has a lack of blood and oxygen, and basically shuts down in certain areas. Heart issues, cardiovascular disease we talked about. Their kidneys, microalbuminuria, which is a protein loss. The kidneys become damaged, and they're a marvelous organ, and they just cannot handle pressure and medication and the toxic side effects that go along with that. And again, poor health, poor diet, and so forth. Neuropathy, sores in the feet. We're going to show you some pretty graphic images in a few minutes. Numbness will start first, tingling, and so forth. So, again, major complications. You see up upper left-hand corner here, the foot. The blackening is actually necrotic tissue. Some of those toes will have to come off in that particular person's case. Usually it happens by wounds that don't heal. So the normal sequelae of events is numbness, tingling, scratch or scrape that doesn't heal. And there's no Band-Aid or no salve that's going to accelerate that, because, again, the healing happens from the inside out. And then what happens is, as the tissue is black, it becomes necrotic or necrose, which means it's actually dying on the body. And if that's not cut away, it can turn gangrenous and actually poison the entire body. The person could actually lose their life. Heart disease, we talked about that. damaged blood vessels in the eye. This is actually the eye, and I'll show you some photos of what exactly happens inside the eye when the retina becomes damaged, and of course stroke. So here's a photo of the eye, and we can see these little white patches are basically areas of the eye that are dying. Now, what happens when someone has poor health and they have diabetes? You can't have diabetes and be healthy. It doesn't work that way. Your health is poor first, then you become a diabetic. Health is poor first, then you have high blood pressure. So again, just because your number is in a normal range does not mean you're healthy. I cannot stress that enough. So again, you'll see hemorrhages in the eye. They'll call these sometimes petechial hemorrhages. Petechial is Latin for very, very small. So basically the eye is bleeding inside. Because again, think of the toe issue not healing. Well, the eye is tissue too, and it's living, so it needs to heal. So again, more damage in the center of the eye, and it just gets worse and worse and worse. Can this be reversed? You know, stopping a process from getting worse is improvement. But in my 20 some odd years of dealing with chronic illness, I've seen miraculous things happen. And I'm not trying to sell you a bill of goods that, well, this work can make a blind man see. But remember, ultimately the body wants to be well. And if we can put in place elements, raw materials, foods, take away foods that are hurting it, and nutrients, the body can do wonders. And we just step back and we let the doctor inside go to work while we're doing everything we can from the outside to propel that process to take place. Now, with an eye like diabetic retinopathy, what you'll see on the right is the vision the person sees. That's why you'll see people say, well, I can't drive anymore, because this is what's happening. The dark spots or the necrotic tissue, or the dead spots in the actual retina, and obviously on the left is normal. So I've had patients come back and say, you know, I'm seeing a little bit better. Can it come back fully? I don't know, but we sure can go from this to total blindness, where the image on the right, he probably loses his license, but he could still function reasonably well in society. But obviously he would not be able to drive. So again, this damage within the eye, these spots are a result visually of what you'll see on this side with these dark spots here. So maybe it's the young man or woman's grandson playing ball with them. Not really fun scenario. Let's move on to the kidneys. Again, the kidneys are real susceptible to pressure and toxins, whether it's medications, ibuprofen, alcohol, it doesn't matter. The kidneys have to filter all this. And again, they're a marvel of engineering. We can't even come close to doing what the kidney does. There's elements in the kidney called the loop of Henle, which are just, a whole book could be written on just what they can filter out and put back in the body. Take out hormones, produce urine, all these wonderful things. What happens is the kidneys become scarred from the inside, and they actually shrink. It reduces their volume. They can't really function anymore. So once they begin to shut down at a certain rate, and there's 5 stages of kidney failure, once they get to about 3.5, 4, solid 4, and the doctor confirms that, usually at that time they'll go for a dialysis consult. Now, I've personally seen patients in my office go from 4th stage back to 0, and the doctor actually canceled their their dialysis consultation. Adamant patients follow the program, key, work with their doctor, everyone's on board. I've seen it happen. I don't want anyone to get into stage 4 and 5 and say, can you help me now? Sure, I'll do my best, but please, if you're not in kidney problems right now, don't wait. It's not a game you want to play, because usually you will lose. So again, on the left is a normal kidney, on the right is an affected kidney, and it's dying from the inside out, from what we discussed a few slides ago, the pressure and the the medication, alcohol, whatever the person is doing along with their health problems. In the blood vessels of the body, cardiovascular disease, if you look on the left, you'll see the human artery. And a human artery is like a muscular hose. And it actually pumps 50% of the blood in and out, and the heart pumps the other 50%. So arteries are very important. And they're flexible, almost like a bungee cord. Once they start becoming unhealthy, they lose their flexibility. So on the damaged side, you'll see the smooth muscle cells and all these problems that are absolutely abnormal to a normal blood flow. And what happens is the body begins to plaque this area because it's actually leaking. It gets little hemorrhages in there, little cuts in there called petechial hemorrhages, and it actually leaks plasma. And that's why you usually see people with cardiovascular problems, they have what's called pitting edema. They'll get fluid in their ankles, their hands will swell. Usually it's the lower limbs though. And the body sends cholesterol plugs to plug up these little petechial hemorrhages. So that's why people with cardiovascular problems will have elevated cholesterol. In most cases, their body is trying to plug up these leaks because the person, number one, isn't healthy. So being a diabetic just compounds this problem and actually adds to it. So again, health first. That's the key I want you to focus on. These are some visual appearances of a person with poor health and a diabetic. You'll see the redness. What will happen is these will become very photosensitive to the sun, and you'll see them get almost abrasions or look like they've been scraped. And usually the nose, and what happens is these areas become very, very photosensitive to the sun. So it's not the sun that's causing these. This issue is coming from the inside of the body because the body is losing its health potential. So again, I'm not here to be your primary physician. That's not my job. My job is to give you a supportive baseline for your regaining your health. Nutrition, lifestyle habits, some key steps as you go through the program. So report some bruising to your doctor so he can take notes, see what you're doing. If you're on my program, let him know what's happening, and he'll keep an eye on this. And as you improve, these things improve. In my video, I have one lady there, we saved her toe. So that's an extreme case. Just like this lady here, no toe issues yet, but the problem is going to progressively get worse. There's no creams that are going to fix that. There's no massage that's going to fix that. We have to support the cells inside the body so they can begin to function, bring in the sugar, bring in the nutrients, clean up the bruising. So this is all dead blood in here and dead tissue. If it continues to get worse, she could have a real problem. Again, some external things that you may see. Looks like scrapes, bruises that don't heal, skin flicking off. These are all, again, the body is not healthy and it's not processing glucose properly and efficiently within the cell. So these are pretty prolific, but most people will say, oh, I scraped myself, and you ask them how long ago, they can't remember. Sometimes it could be months before it. So that's why communicate with your primary, let him know so he can take notes. Sometimes we'll even take photographs, and you can track your progress. And if you're following the program, I can almost guarantee you that you'll see these things shrink up like a drying puddle. It's just truly amazing. Again, extreme case. No lotion is going to fix this man. He is in some real trouble here. And if you go back and see just this area here, if you were to press in this area, he would have something called pitting edema. This looks like where his sock was. Can you see the little ring? So this area here has been compressed by his sock. So he also has, from just looking at this picture, some cardiovascular problems. You see his toes are all fungal, so he has also a fungal infection. So he has digestive problems. So there's a sequela of issues happening, not just diabetes. Here's another good of someone's knee, wound that won't heal. This area here may have been there for several weeks or even a few months. Again, wounds that won't heal. These wounds can become affected and already getting some necrosis in here, some dying tissue. Again, this is an extreme case of a neuropathy that's actually eroding the bottom of the foot. You see the baby toe here, and pretty bad scenario. Usually I'll see these come into my office that are recovering alcoholics or drug addicts, which means their health has been not only perpetuated by a toxic element, but also devoid of nutrients. Because remember, if someone is alcoholic, they're addicted to drugs, my heart goes out to them, but that doesn't change the fact that they're also a poor nutrient case. They probably just don't even eat very well. So these things really can get out of hand. And I've seen them come in for several months, pack these with gauze, and try to get around, and it's just heartbreaking. Another extreme case. I told you there would be some pretty extreme videos. This gentleman here lost his big toe. You see the blackened tissue. That's all in the chronic. They have to amputate these because, again, the chronic tissue will turn gangrenous, and that is poison to the body. And if you don't lop it off, it will keep going. You see, it's already starting here. And then pretty soon, if he would have waited another, I don't know, month, he may have lost half his foot or his whole foot. So it's already spreading. It's called necrosis. It's a Greek word for dead or dying tissue. This poor lady here lost all of her toes. So again, her life is totally disrupted by this procedure. It's always going to be sore. I've never had an amputee come in and say, "Oh, it feels fine." It's always a problem. So making these changes, making these lifestyle choices that I guide you through is nowhere near the disruption that this will cause you. I promise you. Again, another picture of an IV. This is an actual IV going on, and he already has what? A fistula going on here, and looks like he has some other skin issues happening above that. So it's not pleasant, and it's not curing anything. Again, just filtering his blood because his kidneys are so dysfunctional they cannot. Again, I go through all the systems that it affects. It's not just your blood sugar. Now we get to a choice. And, I wish I could reach out there and let you know from personal experience of losing my father and my two uncles who thought everything was fine. Well, my first one, he was 31. I was about 5 years old, so I really didn't know him. But my father and my Uncle Steve, I was a young man at the time. Well, I'm taking my insulin, I'm taking my metformin, I'm taking my hematrophin, or whatever they were taking at the time. I think that's what they were taking. In their mind, everything was fine. But they weren't focused on their health, and that's what I'm here to say. Hey, we need to really grab onto this. And once you get this information and you begin to see your health improvements, I've had patients say, it's a life. It just changed my whole life. You can do this. You can always go back and have these sorts of things, always. But I want you to have a better life than that. And when do you start? You're not, some things I say, well, I'm not that bad. Well, what's it going to take? Is it going to take for you to wake up one day and have a sore that won't heal, or you can't feel your feet? The longer you wait, the more work it is to get back. I will make it absolutely simple for you. So, one day you'll wake up and there won't be any more time to do the things that you've always wanted to do. And I'm here to say there's a lot of things you can do. If you're type 2 diabetic, I've seen people, again, with blood sugar over 800, with A1Cs over 21, that have normalized themselves within 3 months. And they're still on the path to wellness today after a couple of years of follow-up. So do it now, get on track, and me and my team will help you every step of the way. I'm committed. This is a crusade for me. This is my life's purpose. You don't have to die from diabetes, and you don't have to be disfigured or dismembered from it either. There's a lot more that you can do than probably what you're doing now. I'm Dr. George Kosmides. Thank you for taking your time and watching this. And any questions, please contact me at george@drkosmides.com or support@drkosmides.com. If you have questions, I will certainly answer them. And thank you again.